Hi everyone, welcome to my channel Angel's Nursing Decodes. Today we are going to start 30 days learning challenge on newborn assessment. The day 1 we are going to start with a positive quote: push yourself because no one else is going to do it for you. Push yourself because no one else is going to do it for you. Let's see the age and developmental stage. Birth to 24 hours, newborn, 1 to 7 days, the baby is known as early neonatal period. 8 to 28 days, the baby is under late neonatal period. 1 month to 12 months, infant. 1 year to 3 years, toddler. 3 years to 5 years, preschooler. 6 years to 12 years, school age. 12 years to 18 years, adolescent. Let's see the vital signs of newborn. Mostly we have to prefer axillary temperature. The normal temperature of a newborn is 36.5 to 37.6 degrees Celsius, and the heart rate is 120 to 140 beats per minute. Respiration is 30 to 60 breaths per minute, and average blood pressure is 65 by 45 mmHg. Insertion of thermometer into the rectum is not recommended as it can cause perforation of rectal mucosa. Apical heart rate need to be taken for newborn by placing the stethoscope lateral to the mid-clavicular line at the left lower sternal border at the fourth intercostal space. Anthropometric measurements. The normal weight of the baby is 2.5 kg to 3.5 kg, and the height or length of the newborn baby is 50 centimeter. Head circumference is 33 centimeter. Chest circumference is 30 centimeter. Abdominal circumference is 28 centimeter. Let's see about APGAR score. APGAR stands for A for appearance. It means skin color. P for pulse, G for grimace, A for activity, R for respiration. Appearance. If the baby's body is blue, that means cyanotic, or pale all over means we have to give 0 points. If the baby's body is pink in color and if the baby has blue extremities, then the baby is known as acrocyanosis. Then we have to give 1 point. And if the baby's whole body is pink in color, we can give 2 points. Next, moving on to pulse. If there is no pulse, 0 points. Less than 100 beats per minute, 1 point. More than 100 beats per minute, 2 points. Next, grimace. If the baby is floppy with no response, then 0 points. If the baby has minimal response when stimulation, we can give 1 point. If the baby has prompt response, sneezing, crying, or pulling away when stimulated, then we can give 2 points. Activity, no movement and the baby is flaccid, then we can give 0 points. If the baby's arms and legs were flexed, then we can give 1 point. And if the baby is active in movement, then we can give 2 points. Then R for respiration. If there is no breathing or absence of breathing, we can give 0 point. If the baby has irregular or weak or slow breathing, then 1 point. If the baby has vigorous breathing or if the baby has strong cry, then we can give 2 points. The scoring interpretation, if the baby scores 0 to 3, then severely depressed. 4 to 6 points indicates moderately depressed, and if the baby scores 7 to 10, then the baby is in excellent condition. Next, let's see about pediatric Glasgow Coma scale. eye opening. If the baby's eye opens spontaneously, then we can give 4 points. And if the baby opens the eye to verbal comment or for shouting, then we can give 3 points. And if the baby opens the eye to pain, then we can give 2 points. And if there is no response, then we can give 1 point. Then moving on to motor response. If the baby obeys the commands or spontaneously, if the movement was there, then we can give 6 points. If the baby localizes the pain, then we can give 5 points. Flexion withdrawal is there means we can give 4 points. Flexion is abnormal, that means decorticate rigidity means we can give 3 points. Extension with decerebrate rigidity means we can give 2 points, and if there is no response, we can give 1 point. And last, verbal response. If the baby oriented, then we can give 5 points. Disoriented or confused, we can give 4. Inappropriate words, then 3. Incomprehensible sound, 2. If there is no response, 1 for babies more than 5 years. And if babies are between 2 to 5 years, then appropriate words or phrases, then we can give 5 points. If the baby has inappropriate words, then 4 points. If the baby has persistent cry and screams, means 3. If the baby grunts, then we can give 2 points. There is no response, then we can give 1 point. Then up to 2 years, if the baby smiles or coos appropriately, then we can give 5 points. If the baby cries and is consolable, we can give 4 points. If the baby has persistent inappropriate crying or screaming, then we can give 3 points. And if the baby grunts, agitated and feels restless, then we can give 2 points. And if there is no response, 1 point. The total pediatric ascogoma score is between 3 to 15. Thank you for being here on our journey. Next day, we can see the day 2 challenge. Until then, shining off. Thank you.